In the anterior abdominal wall, another important topic that we should know about is the rectus sheath. Now, as the name suggests, guys, the rectus sheath, it is something which is covering the rectus abdominis muscle anteriorly and posteriorly. To understand the rectus sheath, how it is formed in the upper part and lower part, first of all, we need to look into one important landmark here, which is called as arcuate line. Now, look at this picture. This is the rectus abdominis muscle here. Rectus abdominis muscle will be covered with the rectus sheath anteriorly from top to bottom. No issues. But when you look at the posterior wall, the rectus abdominis muscle is removed from this side. So what you see, the posterior wall of rectus sheath, it ends at certain level, which is somewhere between the umbilicus and the pubic crest, halfway between the two. And that line is called as the arcuate line. This line here is called as the arcuate line, also called as linea semicircularis, not linea semilunaris, linea semicircularis. Arcuate line or linea semicircularis. This is basically the lower limit, if I may write for you here. It is the lower limit of posterior wall of rectus sheath. It is a lower limit for the posterior wall of the rectus sheath. So to understand the rectus sheath well, to understand the walls of the rectus sheath, we need to consider at least two sections. We'll take a transverse section which is above the arcuate line, let's say somewhere from here. That will be our section 1. And then we will take a section which is present somewhere below the arcuate line. Let's say section number 2, we'll take it from here. A section above the arcuate line and below the arcuate line. Well, you can already, I'm sure you can imagine this thing, that if you take a section above the arcuate line, then rectus abdominis muscle will be seen covered with the rectus sheath anteriorly as well as posteriorly. But when you see the section below the arcuate line, only anterior wall of the rectus sheath will be seen. Posterior wall will be deficient because this already is the lower limit or the lower border of posterior wall of rectus sheath. So let us take these two sections and understand how the rectus sheath will look like and what all muscle aponeurosis will give rise to the rectus sheath. So first of all, let us take a transverse section above arcuate line. So section number 1, which we said, let us take a transverse section above the arcuate line. Well, and we just need to look at only one half of it. We don't have to see the of both sides simultaneously. Anterior abdominal wall, if you see the muscle coming from the side, we have external oblique, internal oblique, and transverse abdominis. And all these muscles, maybe muscles are going downward, upward, or maybe transversely, but the aponeurosis are coming toward the midline. And aponeurosis of these muscles, when they converge toward the rectus abdominis muscle, they surround rectus abdominis muscle, forming the rectus sheath. So if you take a transverse section above the arcuate line, the muscle that you will appreciate on the side, guys, this is the external oblique, internal oblique, and transverse abdominis. And obviously the rectus abdominis muscle will be seen in the middle. As I said, we are just looking at only one half of the anterior abdominal wall, not the both. So there is external oblique, internal oblique, and that is transverse abdominis. And this obviously is a rectus abdominis muscle. So what you see, that aponeurosis of the external oblique muscle, it goes in front of the rectus abdominis and forms the anterior wall of the rectus sheath. Similarly, the aponeurosis of the transverse abdominis will go posteriorly and forms the posterior wall of rectus sheath. And internal oblique aponeurosis, when it reaches the rectus abdominis muscle, it splits in the anterior lamina, which is present anteriorly, of course, and the posterior lamina, and contributing to both the wall of the rectus sheath, anterior lamina and posterior lamina. And needless to say, we already know what is the most posterior fascia of the anterior abdominal wall, that is fascia transversalis. So look at, these are the two structures which are forming the anterior wall of rectus sheath. Obviously, when the section is above the arcuate line, so you can see the anterior wall is by these two things. One is what? External oblique aponeurosis, and the anterior lamina of internal oblique aponeurosis. This is the anterior wall of the rectus sheath when the section is taken above the arcuate line, external oblique aponeurosis, and then we have anterior lamina of internal oblique aponeurosis. If you look at the posterior wall of the rectus sheath, it is by these three. Posterior wall of the rectus sheath, it is formed by, number one, by the posterior lamina of internal oblique aponeurosis, number one. Number two, it is also formed by the transverse abdominis aponeurosis. You can see that is transverse abdominis aponeurosis. And number three, also by the fascia transversalis. Also by the fascia transversalis. That is forming the posterior wall of the rectus sheath when the section is taken where? Above the arcuate line. So this is the formation of the rectus sheath. Anterior wall is there, posterior wall is also there. Anterior wall and posterior wall by the external oblique and transverse abdominis, whereas internal oblique aponeurosis contribute to both the wall by dividing into the two lamina, and posterior we also have this fascia transversalis. But if I take a section below the arcuate line, the things will change. Now, we can anticipate before we draw that if we take a section below the arcuate line, only anterior wall will be seen, the posterior wall of rectus sheath will be deficient. So guys, let us take a transverse section below the arcuate line. So let's take a transverse section below the arcuate line. Once again, the muscle that you will appreciate on the side will be the same. We have external oblique, internal oblique, and transverse abdominis muscle. Here in the middle, that is the rectus abdominis muscle. So it's all, the arrangement is same. So that is the external oblique muscle, the internal oblique, the transverse abdominis, and there we have this rectus abdominis. External oblique aponeurosis, same story. It is again contributing to what? To the anterior wall of the rectus sheath. What internal oblique and transverse abdominis will do, and you already have an idea about it, the reason the posterior wall is deficient, if you remember, that internal oblique and transverse abdominis together were forming a common tendon called as conjoint tendon. So both internal oblique and transverse abdominis, they together forms this conjoint tendon, which is also present in the anterior wall of the rectus sheath, and posterior wall is deficient, which is only having this fascia transversalis and nothing else. So guys, if the section is below the arcuate line, you can see this anterior wall. This time the anterior wall is just by external oblique aponeurosis and also by this solid conjoint tendon. Whereas the posterior wall of this rectus sheath is deficient. All we have here is the fascia transversalis. It's a deficient wall. Only fascia transversalis is there posteriorly. No muscle aponeurosis is present posteriorly to defend the rectus abdominis muscle or to support the rectus abdominis muscle from the posterior side. So there is a difference in the section of the anterior abdominal wall taken above and below the arcuate line, and that's how the two different type of walls will be seen, one above and one below the landmark that is arcuate line. Now the question also is that what are the contents of the rectus sheath? I mean, one content obviously you can see is that is rectus abdominis muscle surrounded by it. But if you remember, when it comes to the contents of the rectus sheath, it's not one, it can be two muscles which are a content. One is rectus abdominis, that is for sure, no doubt about that. And if you remember, we saw one very small muscle present in the lower part, that was the pyramidalis muscle. Pyramidalis muscle, if present, well, it is not present always. If present, that pyramidalis muscle will also be there inside this rectus sheath. Vessels. Two vessels, or I should say the two set of blood vessels. We have superior epigastric vessels will be there. Superior epigastric vessels. Superior epigastric vessels, if you remember, superior epigastric artery was a branch of internal thoracic artery. We talked about this artery in the thorax. It is coming from internal thoracic artery. And also inferior epigastric vessels, which will come from external iliac artery. These are the branches of external iliac artery. That is inferior epigastric. And guys, be careful. It is superior epigastric, not superficial epigastric. Superficial epigastric was the branch of the femoral artery. It is superior epigastric we are talking about. And some nerves are also the content. Well, I can say the two types of nerve, not two nerves, the two types of nerve. The reason I'm saying two types of nerve, we have thoraco-abdominal nerve. Thoraco-abdominal nerve. This also we talked about in the thorax. The T7 to T11. These are called as thoraco-abdominal nerve. After supplying the intercostal space, these nerves, they enter into the rectus sheath and supply the anterior abdominal wall. That's why we call them thoraco-abdominal nerve. And of course, the subcostal nerve, the T12, is also the content of the rectus sheath. So here are the content. The two muscle, rectus abdominis and pyramidalis, the two set of vessels, superior, inferior epigastric vessels, and we can say the two types of nerves are also seen inside, that is thoraco-abdominal nerve and subcostal nerve. That is about the rectus sheath, the formation, the difference above and below the arcuate line, and these are the contents of the rectus sheath. Continuing in the abdominal wall, from the anterior, if I shift to the posterior abdominal wall, there is one important fascia that we should know about, which will help in other topics as well. And that is the thoracolumbar fascia. There's a fascia that is the thoracolumbar fascia. It could be an image-based question. There could be an image-based question on thoracolumbar fascia. And even if not, if it is a transverse section is given for the relations of the kidney or anything, then you need to know that where the thoracolumbar fascia is and how will you differentiate between the thoracolumbar fascia and the psoas major fascia as well. So guys, to understand the thoracolumbar fascia, let us say if this is the vertebral column here, if this is the vertebrae, here is the transverse process, and let's say this is a spinous process. Now, there are three layers of thoracolumbar fascia, or you can say the three lamina of the thoracolumbar fascia, out of which anterior lamina, you will see it coming from the anterior surface of the transverse process. There is a tubercle on the anterior surface of the transverse process. Middle lamina will come from the tip of the transverse process. And the posterior lamina will come from the tip of the spinous process. And then they together forms this common fascia, that is a thoracolumbar fascia. So these are the three laminas of the thoracolumbar fascia. Looking at their attachment, you should know about to the transverse and to the spinous process. One to the anterior surface of transverse process, middle lamina to the tip of the transverse process, and posterior to the tip of the spinous process. What is also important to note that what are the muscles which are trapped inside. Now, if you see between the anterior lamina and the middle lamina, you will see some muscle here, and between the middle and the posterior lamina also we have muscles. The muscle that you see between the anterior and the middle lamina, guys, this muscle is quadratus lumborum muscle. That is quadratus lumborum muscle. And the muscle that you see, which is present between the middle and the posterior lamina, it is surrounded by the middle and the posterior lamina, that is the erector spinae muscle. Erector spinae, the true back muscle which was derived from the epiaxial myotome, that erector spinae muscle is present between the middle and the posterior lamina. So that again could be a question. The muscles enclosed in the thoracolumbar fascia, that is quadratus lumborum and erector spinae. And well, it's not only erector spinae, if I may add to this, even multifidus muscle will be seen inside, which will be more deeper. So I can add one more, that is multifidus. These are back muscle, erector spinae, multifidus, they are present, they're enclosed inside the thoracolumbar fascia. That is another question. And you should also know, this again could be a question, out of the three muscles on the side of the anterior abdominal wall, external oblique, internal oblique, and transverse abdominis, it's internal oblique and transverse abdominis muscle which are also taking origin from the thoracolumbar fascia. If this is the transverse abdominis muscle, that is internal oblique. Transverse abdominis, and this here is the internal oblique muscle. They originate from this thoracolumbar fascia. They originates from the thoracolumbar fascia. That again could be another question. Even though the latissimus dorsi is having origin, I mean, when you see the latissimus dorsi muscle is also taking origin from the posterior surface of the thoracolumbar fascia. So even latissimus dorsi can be added into that list. But these two muscles, which are the muscles of anterior abdominal wall, that is transverse abdominis and internal oblique, they originates from the thoracolumbar fascia. And coming to the point where I'm saying that if you get a real-time section for this posterior abdominal wall, the transverse section, well, you will not have all these colors to distinguish between the anterior, posterior lamina. So sometimes people might confuse this with the psoas major fascia. Now guys, psoas major fascia will be present something like this. I'm just putting a dotted line around it. You will see it extending from the body and to the anterior lamina of the thoracolumbar fascia. This is, let me write it separately here, psoas major fascia. There is a psoas fascia or psoas major fascia, and obviously the muscle enclosed inside will be the psoas major only. Let me just try to give it a different appearance. That is a psoas major fascia, and the muscle is also there inside. And you know, this diagram will be useful for us later on as well, because this is also indirectly telling you the posterior relation of the kidney. Where is the kidney, guys, in this picture? The kidney will be somewhere here, isn't it? The kidney will be here, and the three muscles which are forming the floor of the kidney or the posterior relation of the kidney are these only. The most medial muscle is psoas major, followed by quadratus lumborum, and then most lateral is transverse abdominis. That's how they're arranged. Psoas major, quadratus lumborum, and transverse abdominis, all the three muscles here, these are the ones which are forming the posterior relation of the kidney, which we will discuss eventually. So this is the must know thing about the thoracolumbar fascia, that what muscles are enclosed inside, what muscle originate from it, and make sure you separate it from the psoas major fascia as well.